This screencast is about somatoform disorders. Somatoform disorders are really quite interesting. So, what we have are disorders that originate from the body. So, soma means body in Greek. You'll see that word soma all the time, and it means body. So, think of from the body. And what happens in somatoform disorder is that we have psychological conditions where psychological conflict is translated into a physical problem or complaint. And you're going to have this like physical fallout. It's going to look like a physical problem, but there's going to be no physical evidence to support the problem, and it is psychological in nature. So, some theorists think that somatoform disorders involve the translation of unacceptable drives or troubling conflicts into physical symptoms. I mean, this is a very Freudian way to view this. One of Freud's early clients actually had somatoform disorder, and the presentation was called glove paralysis. So, like a glove on a hand, the patient's hand was paralyzed. But physiologically, you can't really do that unless you like cut the hand off and sew it back on again. So, if you have paralysis in your hands, the nerves kind of run down one side, so you could have paralysis in these two fingers, or down this side, and you could have paralysis in these two fingers and thumb, but having full paralysis is quite unlikely. So there's no medical evidence for the physical problem, hence it's psychological. So, somatization disorder. What this is multiple and recurrent bodily symptoms that lack a physiological basis. And again, it's an expression of a psychological issue. So frequently you'll see people with chronic headaches or stomach aches or something like that, but when they go to the doctor, there's no medical basis for the problems that they're having. Pain disorder is another somatoform disorder. Here, the only symptom is pain that has no physiological basis, and the pain can be anywhere in the body. Hypochondriasis, I like this disorder. I have a joke about hypochondriasis where I tell students about the disorder, and they say, "Oh my God, it sounds like I think I might have that." And what hypochondriasis is really, you've heard that term like somebody is a hypochondriac, but what hypochondriasis really is a misinterpretation of normal bodily functions that becomes a sign of serious illness to the individual. And so, like, you'll have somebody that has a headache, but they'll think that they have a brain tumor, or they'll have stomach cramps and they'll think they have cancer, or some serious disorder like that. Okay, now another disorder that you might have heard of is malingering. And what malingering is conscientiously faking a disorder to get some sort of benefit. So malingering basically means lying. And as a psychologist, we have a number of tests to determine if somebody is malingering. Sometimes people malinger good, sometimes people malinger bad. It depends on the case, and there's lots and lots of reasons why. Factitious disorder is a little different. Somebody is faking the disorder, but they don't consciously have an awareness that they are faking the disorder. Munchausen syndrome is really interesting. This is related to fictitious disorder. And Munchausen's disorder is a little different, though. So here, what happens in Munchausen's disorder is that somebody poisons himself or makes himself sick so they can get attention from doctors or something like that. So fictitious, both these are like a fake illness. This one, you do it without conscious awareness. Munchausen's, you're doing it purposely. So that's named after Baron von Munchausen. And then both fictitious and Munchausen's can be done by proxy. And what that means is that the parent is the one that is faking the disorder in the child, whether consciously or unconsciously. And honestly, I have seen, and I'm not sure, this was a case that I saw a long time ago. It was while I was in grad school, one of my fellow interns had a client that we suspected that the mother was either consciously or unconsciously making the child have the sick role. One really weird thing is that the child had really bad acne, and we in supervision we were talking about the acne, and my friend, who was the therapist for this little girl, found out that the mother was creating these pastes to put on the child's face, and she would make them out of fruits and sugar and all this weird stuff that she would blend up in the blender and put on the little girl's face. And the little girl had chronic acne. She was going to the dermatologist once a week for this. But here, this mother had this weird concoction that she introduced. The case was a lot weirder than that. Out of a school year, the little girl missed 120 days out of the previous year's school session because of illness. It was really odd. So that does happen. Look at this picture here. So this individual here, looking in the mirror, sees this individual here. What do you think's going on there? Well, there's a disorder called body dysmorphic disorder. And here, individuals are preoccupied with the idea that part of their body is ugly or defective. And so people really have a catastrophic misinterpretation of what their body actually looks like. And for men and women, it's typically different areas of concern. So men are more concerned with body build and thinning hair, women more weight and hips, but other areas that are common are skin, hair, and nose. Okay, so theory and treatments of somatoform disorders. Well, there's lots of different ways to conceptualize the pathology of somatoform disorders, but before we do that, there's a number of different treatments. Cognitive behavioral therapy is probably the best option, but there are other therapies that have been used with somatoform disorders. And actually, let me go back here, because I guess I don't have a slide on this. So what the theories are of the somatoform disorders, really, we don't know. Some people think that it's hardwired in the brain, that the brain, when you're encountered with psychological stress or distress or something like that, instead of sending signals to emotional centers of the brain, for some reason the brain is sending signals through the autonomic nervous system to the body. So there could be a biological basis for it. We talked about a Freudian theory. So from the psychodynamic perspective, this is the body representing psychological conflict or anxiety or distress and manifesting it as physical symptoms. It could be learned behavior. There's so many different theories. We don't really know. It's probably a combination of a number of things. Now, psychological factors can definitely affect medical conditions, and on the other side, medical conditions can also affect psychological factors. This is one reason why doctors need to be psychologically savvy. Frankly, I think they need more training in psychology, and psychologists need to understand medical disorders as well, because a lot of medical disorders can present themselves as psychological. The best example would be hypothyroidism. Somebody that has hypothyroidism is going to look like they have depression. So there's lots of other disorders. Let's see, like after someone has a heart attack, they will get depressed after that. So you have depression following a heart attack. It's so common that the standard treatment following heart attack is to prescribe antidepressants. Even disorders like asthma, there's psychological factors can impact asthma and can be associated with the trigger of an asthma attack. So there's lots of different conditions in which a client's physical illness is adversely affected by one or more psychological stressors. So, I mean, I cannot really think of a disorder that isn't impacted by stress in some way or form, or depression, or denial. So there's lots of different things that can be related to health disorders. One film that I typically recommend students watch is called Stress, Portrait of a Killer. I might link to that in this class. I'm not really sure, but you can find that on YouTube. It stars Dr. Robert Sapolsky. Again, Stress, Portrait of a Killer. It's an excellent hour-long documentary film. Here's a lot of different medical conditions. You can see psychological factors that impact the medical conditions. So, there's really a theory that we have an interaction between the mind and the body. And I mean, that's difficult because one is material and one is immaterial. And so the division between the mind and body is an idea that was proposed by Descartes. This is one of an illustration from one of Descartes' textbooks. We call that dualism. But the mind and body do interact. And there's lots and lots of different factors. I mean, the most important thing is stress. So remember stress. And what stress does is it triggers the autonomic nervous system, which triggers the parasympathetic nervous system or the sympathetic nervous system. Lack of stress is parasympathetic. Stress is sympathetic. Remember that from the anxiety lecture. So the sympathetic nervous system is sympathetic to the grizzly bear that's in the room. And that stress response releases a number of hormones, and the stress response is really negative to the body. And we know that most psychological disorders follow that diathesis stress model. So you'll have a genetic predisposition to the disorder, and then with the right combination of stressors, you may see the expression of the disorder. The way that people are oriented to stress can impact their well-being. You might have heard of type A personality disorder, or I'm sorry, personality pattern, not disorder. People that are type A are high-strung. They get a lot of stuff done. They prefer quantity over quality, oftentimes multitasking. That can actually have negative health effects. And then there's a whole field called behavioral medicine or health psychology. Behavioral medicine is an interdisciplinary approach to medical conditions affected by psychological factors that's rooted in learning theory. And this really impacts us in the psychology field because we can really provide psychoeducation so people understand how psychological factors can impact medical disorders. Okay, now we're totally switching gears. The dissociative disorders are another category of disorders. I want you to say that word right there. Dissociative. Dissociative. A lot of people want to put an extra dis and an A in there, and they'll say disassociative, and that's not correct. It's dissociative from the word dissociate. The dissociative disorders are really popular. You might not exactly know what I'm talking about, but if I said multiple personality disorder, you probably go, oh, yeah, I've heard that. Multiple personality disorder isn't in the DSM. So we have another disorder that's kind of taken its spot called dissociative identity disorder, or DID. Now, these disorders are really controversial, but they're very real. A lot of people think they're fake. No, they're very real. And the sad thing is that the genesis of these disorders oftentimes is in trauma. So somebody has experienced not a light trauma either, but severe trauma, and then you'll see the pattern of dissociative symptoms following that. Even PTSD has a number of dissociative symptoms. So Three Faces of Eve was a famous book that was later made into a movie. This was written by two authors that are very important in the field of psychology, Corbett Thigpen and Hervey Cleckley. Cleckley is really a good author. But they wrote this book as kind of it's supposed to be like a case study of a woman whose real name was Chris Sizemore, but they changed her name to Eve White. And the book recounts the story of Eve White, who was diagnosed with multiple personality disorder, now would be dissociative identity disorder. So that book was very important in popularizing the disorder, but there was another book that came along, Sybil, that became even more important in the field of multiple personality disorder. So Sybil was written by a woman named Flora Rada Schreiber, and Flora Rada Schreiber was an English teacher at John Jay College of Criminal Justice, which happens to be where I went to graduate school. And Flora Rada Schreiber was close personal friends with a woman who was a psychiatrist whose name is Cornelia Wilbur. So Dr. Wilbur was a psychiatrist, a real person, and was close friends again with Flora Rada Schreiber. So they collaborated to write this book based on the life of a patient. Now the weird thing is, if you really look at like the timing of this, I believe that they decided to write the book before they had the patient. So that's kind of weird. Now the reason that I know this stuff is because I worked on a documentary film about Sybil while I was a student at John Jay College of Criminal Justice. So I had this weird set of circumstances where I met a professor named Robert Reber. And Robert Reber was a psychologist and professor at John Jay. He was given some audio tapes by Flora Rada Schreiber years and years ago. because he was doing linguistic research and he was looking at language patterns in people with psychological disorders. I think that Flora Rada Schreiber wanted him to publish an article based on these tapes. But what really happened was, for some reason, they didn't get along very good. And Dr. Reber ignored the audio tapes by Flora Rada Schreiber. And these were audio tapes of therapy sessions with Sybil. Sybil's real name, we now know, was Shirley Mason. And so Dr. Reber took these tapes and just put them in his office. Now, I worked with Dr. Reber. I saw what his office looked like. It was a disaster zone. It was stacks of books to the ceiling. Like, oftentimes, like, shelves deep up to the ceiling with dust everywhere. It was unbelievable. The man was brilliant, absolutely brilliant, but he wasn't very cleanly. And so his life was about books and reading and studying, like a true academic. But I was always afraid when I was in his office that one of these stacks of books was going to come down and crush me. So I was intrigued by the story and I wanted to know more. And after Flora Rada Schreiber died, her archives were donated to the library at John Jay. So I had an opportunity to go through all this stuff. And really, my goal was to make a film about this. And I interviewed a handful of people. There was another psychiatrist named Herb Spiegel. And Dr. Spiegel actually would fill in for Dr. Wilbur when she was on vacation. He thought that the case was ridiculous. So, like, based on these tapes and Dr. Spiegel's information, they concluded, this is Reber and Spiegel, kind of independently of one another, but reached the same conclusion that potentially Dr. Wilbur was suggesting that Shirley Mason developed these personalities. And they thought that what was happening was that Shirley Mason was highly suggestible and took the suggestions from Cornelia Wilbur to almost fabricate the symptoms of multiple personality disorder so that she could become famous and write the book. After the book comes out, they sell millions and millions of copies, and then there's a famous movie. If you haven't seen it, I suggest you watch it. So it's one of the most famous cases of multiple personality disorder. Again, now dissociative identity disorder. And the legitimacy of the book and really then the film is in question. So it was fascinating. If you want to know what happened to the documentary film, I quit. It was really arduous, and I had a number of professors say that I could potentially ruin my professional career if I continued to go down this road. So all the info is sitting in a box at my parents' house. So, the forms of dissociative disorders. The first one is dissociative identity disorder. And here, a person develops more than one self or personality. So what happens is that somebody will dissociate or kind of go away from their self. And that might sound weird to you, but I'll bet you all of you have done this at one point. Have you ever had the experience where you're driving down the highway? And actually, now that I've moved to Wyoming, this happens to me more so. And I'll be driving along, and then, like, all of a sudden, I'll kind of snap to, and I'll go, oh my God, like, I have just been driving for like 10 minutes, and I wasn't paying attention at all. Or, like, I'll find myself driving, and I'll get to where I'm going, and I'll say to myself, like, oh my God, I was not paying attention at all. I was somewhere else. And that's like dissociating. It's kind of going away from yourself. Now, Another way to think about this, and this is different, this is drug-induced, but if you've ever heard of or potentially experienced a blackout from alcohol, I want you to think about that. So you should know what a blackout is. It's when you drink too much and you have a period that you cannot account for that time, but you were awake and you were doing things. So people will hear about things that they did and they have no recollection of that. I want you to think about that with dissociation, because it's very similar. Obviously, the person's not using alcohol, because then that would be a different pathology. But if you just woke up and you had no idea what happened, you had a lapse in time, that's kind of what this is like. And so there's other personalities that the person may or may not be aware of that they have, that will come out in times of dissociation. There's another disorder called dissociative amnesia, and this is an inability to remember important personal details and experiences. So usually it's in a time of stress. Somebody will forget like who they are or what they're doing, or maybe their family. It's really quite intense. Another disorder that's really interesting is called dissociative fugue. And what happens here is that, again, a person is confused about their identity, but instead of like staying in place, they fugue means like to get away. And they suddenly and unexpectedly travel to another place, and then they can't remember details about their history or identity. Another disorder is called Depersonalization Disorder, and here the individual experiences recurrent and persistent episodes of depersonalization. They don't feel like a person. They might feel like things going on around them are unreal, like maybe they're in a movie or something like that. There's lots of different theories and treatments of dissociative identity disorder, but really the goal is to integrate the alters, or alters is a term for the other personalities, so alter personalities. There's lots of different therapies available, but cognitive behavioral techniques are probably the best. I have a tendency to kind of shy away from hypnosis. And as a note, that Dr. Spiegel that I talked about with Sybil is one of the world's leading researchers in hypnosis, and he has found that there's a small percentage of people that are highly hypnotizable, like 5% of the population, and they're at risk for developing dissociative disorders. So from the biological perspective, obviously there's distinctions between real and fake psychological symptoms, but we want to determine why the disorder is happening. Maybe it's cognitive explanations, so it's the way that the person is thinking. They have a number of cognitive distortions. Maybe they've learned or reinforced this behavior in some way. But we know that stress really impacts our physiological functioning. With chronic stress, we can see changes in the brain, not just hormonally, but also in brain structure, specifically in the hippocampus, and it might be something with that. So, what really causes the dissociative disorders? I don't know. I have no idea. Again, it's probably going to be some sort of genetic predisposition. And then here, unfortunately, I want to stress the stressors. So that's going to be very important. And the trauma, the traumatic episodes in the individual's past are a very common theme in the dissociative disorders. So stress and trauma, very important to this lecture. These disorders might seem kind of strange to you, but they're frequently portrayed in television shows and in movies, frequently portrayed wrong as well. So I want you to think about that. look in the DSM, look at the symptoms of these disorders, read your textbook, and as always, let me know if you have any questions.